our first session for this part is on, like I said, food as medicine, which is a topic that's a very old topic, but also a very young topic in many ways. So we will be talking about the recent developments in this area and how medicine has really been given a jet-fueled boost by startups and by VCs in creating this whole new category. So I'd like to introduce our moderator for this session, Darren Streiler with ADM. Darren, take it away.
Howard, Nick, thanks for having me today. Darren Streiler, Managing Director of ADM Ventures. We are the corporate venture capital arm of ADM. Maybe what I'll do real quick is just kind of ask each panel member to introduce themselves and their company, and maybe just kind of briefly talk about, what is your current involvement in food as medicine, whether that be through an investment or your kind of current operations or otherwise. Ashlie, I see you kind of next to me, so maybe kick it off.
Perfect. Thank you so much. All right. So my name is Ashlie Burkart, and I am the Chief Scientific Officer of Germinate Ventures, which is a venture capitalism firm that's focused on backing impact-driven companies in the food and agricultural space. So we tend to invest in seed, Series A and B. And the reason food as medicine speaks to me, it speaks to me on a professional, on a personal, and on a research-related reasons. So on the professional level, I've been practicing in guts and butts for over 15 years. So I'm a GI and liver pathologist. So a lot of people are like, what is a pathologist, first of all? So we're medical doctors, but we are the scientists kind of medicine. So I did 2 residencies at Johns Hopkins. I did one in anatomic pathology, which is looking at tissues and making diagnoses, like, let's say, someone has colon cancer or inflammatory bowel disease or whatever it might be. But then I also did clinical pathology, which is running a molecular pathology lab, microbiology, clinical chemistry, etc. So, again, that's the professional side. Now, the personal side is I've been a doctor, but I've also been a patient. And I was having an good academic career. I had just won the 2 top teaching awards for my medical college. Things were going extremely well. And then I got very sick. And this is what really kind of brought me interested in the space of food as medicine. And that's because I went through all of the conventional medicine treatment paradigms. I was on steroids and IVIG and CellCept and everything else. And it was my 5th hospitalization when they tried to deliver me yet another diagnosis. And I thought, at this rate, I may not be around in 5 years. And I had 2 young kids. And so it didn't seem like a lot of risk to try something new. And so I kind of took on some citizen science and, whatever information was out there regarding the biome, regarding gut health, regarding chronic health, and, almost tried to modulate my own health through food as medicine. And lo and behold, here I am today. And there's no evidence of a blood disorder or a lung disorder or peripheral neuropathy like I had, which is very good news. But that's why the third part of this is the research side, because as a scientist, being an N of 1 doesn't feel very scientific. And so I went back and I actually have a former medical student of mine. He's an MD PhD at Harvard that I recruited to write a grant with me, and we recruited another resident, and we're actually doing research now on why the gut modulates chronic health. So, those are the 3 arms. So then you might ask, well, why VC? I think for too long, the worlds of food and medicine have been separate, and I really wanted to have a larger impact on health and the environment. And I met Michael Lavin. He is the founder of Germinate, and anyways, when I met him, I just realized we were on the same page, because if you really want to have a large impact on health, and by health, I don't mean just human health. We're talking about microbiome health, soil health, ecological health, planetary health. You do it with food and ag. And so that's kind of, so we decided to kind of move my skill sets over to becoming like a medical ecologist per se. So one last thing I really think is great about Germinate is, for us to invest, we not only need to show a profitable financial profile, but we have to show impact. And it's been a great experience. So thank you.
Wonderful, Ashlie and Michelle. I see you next on my screen.
Hi, nice to meet you all, and thanks for including me. I'm Michelle Davenport. I'm an entrepreneur and advisor, and my last company is Raise Real. We're a direct-to-consumer kids company that's sold online, and just recently is now in retail at Target. I advise companies that are nutrition-related, one being Ritual, a direct-to-consumer vitamin company. So I do a lot of nutrition startup type stuff. It's because I have a PhD in nutrition. I'm also a dietitian, trained at, got my PhD at NYU, and got my dietitian training done at UCSF. For me, it was really, I guess if I have to backtrack, like as to why I went into nutrition and, you know, went into those whole food as medicine things, that really has been my life. And that's what nutrition is. It's because my family has a huge history of diabetes. I have 8 aunts and uncles on my mom's side, and almost all of them, except for my mom, thank God, have like full-blown diabetes. And so when I was in my 20s and I had gotten into med school, I was like, I don't know if this is exactly the path that I want to take, because I wanted to stop diabetes from happening instead of trying to treat it with all sorts of different, you know, medications and prescriptions, which is what, you know, the practice of medicine is right now. But with nutrition, you know, it was more of a focus on how to prevent it from happening. So that's how I took an interest in, you know, my food, and trying to, it was kind of a selfish reason in the beginning, you know, really wanting to make sure that I wasn't going to get diabetes myself. So in grad school, I was focused on diabetes research and did that for my dissertation, and looked at kids developing diabetes in an early age. And that's when I started really kind of taking interest in kids. And right now, actually, like my mission with the projects I select as an advisor, even the ones that I'm working on my own, my projects are always focused on looking at the future and innovating for kids, because I really feel like if you're going to focus on the future and create things that are going to impact tomorrow, then you focus on the next generation. So that's what I do, and it's really enjoyable. And I think that nutrition has kind of like been my catapult to getting into startups and food and tech, but it's these days I'm not really practicing that much anymore as a dietitian.
Wonderful, thank you, Michelle. And last but not least, Steve.
So I don't have my MD or my PhD. Steve Sanger, partner at Evolve Ventures. We're a $100 million corporate venture capital fund backed by Kraft Heinz. So Kraft Heinz is our single LP, and we make investments across the food value chain. You know, food is medicine, and healthy food is very important and a core part of our team's thesis. I serve on the board of Joywell Foods, which was an investment we made about a year ago, which is using biotechnology and fermentation to make alternatives to sugar. And, you know, Kraft Heinz has some stated ESG goals. And so, you know, this is an area that, you know, I think if you're an investor, investing in health and wellness is just kind of table stakes within food. And for me, it's very personal. I have a daughter who has a chronic medical condition as well. And so, you know, food is going to be a huge part and to help in her development as she gets older. And so not only is it a passion of mine from an investment standpoint, and it's a huge area of growth, but I wouldn't be doing my job as a father if I didn't really try to do what's best for my daughter and for her care going forward. And so, you know, very excited to see the development and what's happening in this sector, and look forward to chatting more.
Wonderful, thanks, Stephen. I guess I should probably mention that ADM, obviously we are active in this space. We do have a health and wellness business unit that has a portfolio of products and ingredients, most of which are pre, pro, and postbiotics, but we can get into kind of more of that later. Maybe what I'll do is just kind of start. You know, this is an investment focus conference here, and it's all about opportunity, right? You know, how are each of you or your companies really viewing the real opportunity to use food as medicine, right? You know, what is the kind of the economic benefit at the end of the day for a company that's playing in this space.
Well, I can start off from a Kraft Heinz, perspective. I think we see a tremendous amount of opportunity. It's certainly an area of interest for the company, and so our investment view in the category certainly mirrors that. I think one of the things, if you're a large food and beverage, CPG company, that you need to take into consideration, food as medicine is just a really interesting category. Number one, we look at it, but we also personalized nutrition is not something that companies like Kraft Heinz or larger companies are very good at. We're really good at producing mass food at scale. And in order to do that, you need to transition manufacturing lines to get into personalization, which is not very easy to do. And that's something that we think about. I think we have a lot of discussion internally about, is it better? Does personalization, is it truly needed? Or is it just healthier food for the masses? And we have that debate that goes back and forth. And, Darren, you guys just invested in Nourish, right? Which we looked at them well, and they have some very interesting, technology that, potentially 3D printing, maybe that lends itself at scale to more personalization. And that's an unlock to truly understand, hey, what is Steve Sanger's microbiome telling us, and what are the foods that he should be eating, right? I think that, and I think too, is clarity around what food as medicine is. There's a lot of, everybody I think has different definitions on what that is. But those are some of the things that we contemplate, as a company, and we think about as a fund when making investments in this category.
Yeah, Steve, you bring up a great point, with personalization, right? And personalized nutrition. Consumers are really demanding more personalization, right? They want medicine for them, right? What tailored solutions can I have for, as Michelle mentioned, if my family has a history of diabetes, right? Or if I want to lose weight, or if I have high cholesterol, right? Consumers are increasingly demanding a personalized kind of food as medicine, right? And that brings a lot of challenges, as you mentioned, with, how do you do mass scale kind of commercialization if you're a Kraft Heinz, if you've got, so many different variants of products out there. So it really did speak to the challenge. I think, if I may, just kind of, we started off, what is the opportunity here, and just kind of bigger picture, right? That there's a real convergence potentially of food and pharma, right? And if people are taking preventative, food, beverages, supplements, to kind of ward off potential indications or ailments in their life, then they're effectively taking market share and sales away from pharmaceuticals. In the hopeful event that they won't need those pharmaceutical products later. But yeah, Ashlie or Michelle, just curious your thoughts on preventative, right? If you have a history of diabetes, then how can I tailor my diet, right, to I guess avoid situations like that?
I'd love to chime in. I think we're talking about two different things here. So what I'm hearing is we're talking about like personalization of offerings, right? So with the set of products or SKUs that you have, like how do you personalize experience to your customers, which is what a lot of startups are doing now. And then we're talking about personalization of the actual food and the composition to each individual. So the first is really easy because, now with direct to consumer technology, it's really easy to tailor things, tailor offerings to your customers. The second one is hard. I don't know if we're quite there yet, research-wise. My one gripe with nutrition studies is the way that we're approaching them is still kind of like this shotgun approach where we have blanket studies and then we kind of try to tailor them to like personalized recommendations. There's a lab that I follow in the Netherlands called the Nth Iteration Lab with Maurice Kapstein, and he's amazing. And what he's working on is computational methods for personalized medicine. And a lot of what he's doing can be applied to personalized nutrition research also. But my favorite quote from him is that in the age of machine learning, it's actually unethical to have randomized controlled studies. And I totally agree, because it's the reason why we can never replicate nutrition studies. Like, it's why Mediterranean diet is hot one day and the next day it's not. You know, resveratrol and wine was hot one day, the next day it's retracted. So until we can perfect the nutrition studies, I don't think we can extrapolate from that and say that these are like the personalized recommendations that we have. Once we get to that point, though, it's going to be like a whole other ball game. You know, once we're able to actually say, like, based on your biome, microbiome, and your DNA, this is what you should be eating. I would love for it to catch up to that point.
Right. Yeah. I mean, should I chime in what I think food is medicine means?
Yeah, please do.
Okay. So, I mean, which actually, coming back to what Steve was saying, I think there's a little difference between food is medicine versus food as medicine. Food is medicine. It's just eating healthy and, you know, making, like you said, high quality food available for people. I see food as medicine as a little different. Again, food as versus is. Food as medicine is empowering people to be their own healers and using food to target disease or pre-disease states. And so I would kind of put it into two broad categories. And again, food as medicine can be defined by people in so many different ways. This is just kind of my way to try to simplify it. I would break it into nutraceuticals and into precision nutrition, or what we've been calling personalized nutrition. So in terms of nutraceuticals, those are compounds from nature that are found to have health benefits. And Michelle mentioned a couple of them. Like, for example, you can take a supplement like quercetin, or you could have a functional food like capers, which is high in quercetin. Okay, so that would be a nutraceutical. But what's interesting about that is that we only know about 1% of the plant compounds right now. So in other words, 99% of plant compounds are unknown, and we call this dark nutrition, which actually showcases something, a company in our portfolio called Brightseed. They to me epitomize the idea of food as medicine, because they have an AI platform called Forager that is trying to find phytonutrients that would be beneficial for health. So that's kind of part of the discovery process, which is interesting. The second leg is what everyone's been alluded to, is this precision nutrition. And I agree, we are at the base of a mountain looking up. But what it means is that this one size fits all diet is probably going to be replaced. And again, these are for people who are trying to heal their guts, you know, not necessarily, you know, for maybe a healthy biome might be different, but this would be replaced by a customized diet based on people's genetics, their disease state, their microbiome, their metabolome, things like that. And I think what we're learning is that you are not what you eat. Remember the whole saying, you are what you eat? It's actually not true. You are what you digest and you metabolize. And I think most people don't realize that we outsource much of our digestion to microbes. For example, your microbiome will determine your glycemic response. So getting back to the diabetes thing, your microbiome will determine what calories you derive from food. It will also modulate your food cravings. And so this kind of makes something like how we approach diabetes and obesity. Maybe it's not so much like this person caused this. Maybe it's truly a disease of dysbiosis. And maybe the personalization is, how do you heal the dysbiosis? How do you target that? So, and another perfect example of how things will become precision, take, for example, did you know that you need the right bacteria to get the anti-cancer benefits of broccoli? Many people don't realize that. So one person could eat broccoli and get the anti-cancer benefits and another won't. And, maybe this is why kids will say, hey, I'm not going to eat my broccoli because I don't have the right bacteria. And the problem is, science really is on her side if she says that. But how, you could say is that science is now also showing that we can replace those bacteria. And as a proof of concept, a lab in Singapore actually engineered bacteria that can break down that broccoli to make that anti-cancer effect. And there's mouse studies showing that it could be used, just diet in this bacteria, to shrink tumors. So it's kind of interesting because I'm finding that the food, or the precision nutrition and precision medicine, are barriers that are overlapping. And in fact, we're even looking at a company that's looking at the microbiome in regards to cancer and cancer response to treatment. So it's pretty exciting out there. But I agree with Michelle. What do we need to get, to precision nutrition? It's going to be, a lot of it's going to be based on AI and technologies to study humans, to study microbiomes, to study our food, like what Brightseed's doing. But I feel like if we're going to have a key target, it probably, the lowest hanging fruit would be modulating the microbiome and doing things that will help gut barrier health, because those are the key underlying factors that have been linked to chronic inflammatory illnesses. So to close this, we're at the foot of the mountain looking up, but at least we finally have the right tools to get us up there.
Right. And I guess just kind of taking a step back, for some of the novice, maybe, in the audience here, consumers, I mean, obviously you can easily, sample their DNA, right? With tests like 23andMe, and it's the costs have come down such that, you can kind of understand your DNA a little bit better, but, taking a step further, understanding one's, microbiome, right? It's these trillions of microorganisms that are living on or, inside your body. In particular, as you mentioned, Ashlie, the most important really, as it relates to kind of food here is your gut microbiome, right? And in how that microbiome interacts with the ingredients you're taking, and then in effect, has various, I guess, effects on your body. What is, I guess, taking a 23andMe test, it's somewhat, becoming, I guess, easier to kind of prick yourself or do a saliva test or things like that. Obviously, to test your microbiome, it's a little different, right? And consumers have to either kind of, send in a fecal sample or something like that. What, do you see, I guess, major, hurdles to kind of consumers opening up to really understand what their microbiome is? I mean, how is the testing of this making it easier for consumers to kind of understand this?
Yeah, I mean, maybe Darren, I'll just chime in really quickly. I think even before that, like educating people on what the microbiome is and how important it is, I think is the starting point, right? Like, I think there's a lot of people out there. I think when we've looked at research that's been conducted, there's a lot of consumers that just don't. There's a lot, and Michelle and Ashlie can certainly speak to this much better than I can, but, there's a lot that's unknown about the microbiome. And I think, you can do tests with companies out there. I think one of the things that we think about from an investment standpoint is what's the feedback loop, right? Is, okay, I've sent in my sample. You told me I need to eat this. Like, what is it? Like, what's that feedback loop that shows that it's working? And I think that's something that we haven't found that unlock in a lot of these companies. And I think that some of the early companies are trying to think through that. Like, how do I keep you as a consumer engaged so you keep coming back, so you're not, 23andMe, one test, like, hey, I was Irish on the last test and I'm still Irish on this test, right? That's something I think a lot of these companies are thinking, but we think a lot about feedback loops.
Yeah, agreed. I think, well, one, it's hard to get people to poop for these studies, but what's interesting is we are finding that a lot of the metabolomes that is found in stools actually in blood. So we might one day be able to use blood as a surrogate, but that's kind of jumping ahead of myself. So, again, I think just to back up so that the audience understands this, that virtually all chronic diseases has been shown to be influenced by the microbiome. I mean, this includes cancer and autoimmune diseases and neurodegenerative diseases like Alzheimer's and Parkinson's, and neuropsychiatric diseases like anxiety, skin disorders, asthma, joint disorders, autism. I mean, the list goes on and on. So, I guess the question is, how does the microbiome impact health? And I'll quickly can like say, some taglines. One is through the metabolome, which we've already discussed. It's how it breaks down things into chemicals. It can make it either good metabolites or bad metabolites. It can actually turn on and off human genes. It's epigenetics, which actually sounds not like science fiction, but it's not. Bacteria can actually sneak their way through the wall of the GI tract and then translocate to other parts of the body, which is why something called intestinal barrier dysfunction is a hot subject in the science right now. It can actually hijack the nerve that communicates between the brain and the GI tract called the vagus nerve. So I always say whatever happens in vagus doesn't stay in vagus, and then it can impact gut motility, and lastly, can modulate your immune system. So it can do all sorts of things. So when you were asking about 23andMe, 23andMe is only looking at our DNA. And that used to be a colossal event. I mean, the first time that we sequenced the human DNA, it took us 13 years and $1 billion. Now we can do it for under $100 and in less than a day. And in a couple years, it will probably be in a few minutes for a few dollars. I mean, it's amazing how that's changing. But as you were saying, humans have only about 25K genes, and our microbiome has hundreds to thousands of more genes. And actually on a DNA level, we are actually more microbial than we are human, which is kind of insane to think about it. So yes, studying the microbiome has been a lot harder. And I think like you alluded to, we don't really have an answer, but we're getting closer. So for example, the last 10 years, we've been really focusing on who's in the microbiome, and that's called, DNA sequencing, metagenomics. But that would be like studying Philadelphia by asking a list of who lives in the city. We want to know what they're doing. And that's what has been happening the last couple of years, which is called metatranscriptomics, which is what are they doing? Which genes are turned on and off? Which is, then you can start kind of profiling disease states versus non-disease states based on the genes that are turned on and off in there. And then now we're even moving into metabolomics, which compounds are making, and then proteomics. So essentially, we're just getting all these omics that will add more and more information. That being said, it is so much information. RNA, for example, they say one specimen can have like 1.6 billion lines of data. So, taking all this information and putting it together is going to be, a colossal event. But I'll just close it with this. Think about when you think of a chessboard and it has 64 squares, and if you would put 1 grain of rice on the first square and double it, by the time you got to the 64th square, you'd have more rice than had ever been cultivated in the entire planet. And right now, in terms of AI and computers, we're about at the 61st square. So the doubling power gets pretty impressive, meaning it may have taken us this long to get where we are, but every 2 years or so, we're going to be doubling that. So we're kind of in a prime spot to understand this, if that makes sense.
Mm-hmm. Michelle, I'm sorry, you're going to say something?
Yeah, I just wanted to chime in on the consumer behavior part. So as someone who's been selling nutrition for a while, sorry, my kid walked in. So prevention is really hard to sell. People are not invested in the idea of like potentially being healthier one day. That's why vitamins don't sell as well as pharmaceutical products. Now, relief from symptoms and relief from disease is really easy to sell. Drugs are easy to sell. So once people are accustomed to the idea of being relieved from certain diseases, I think it's just going to be snatched up like that, and they're going to get it. Now, putting myself into my mom's shoes now, my son has horrible food allergies. I mean, he's allergic to everything from nuts, dairy, fish, eggs, like different types of vegetables. He did have a very limited palate. And so when I was starting to research all this, I learned that, it's gut microflora related, and breastfeeding is one of the best things you can do. And so I just kept breastfeeding, and he's been growing out of his allergies. And I've heard that from a lot of other moms who are experiencing the same thing. Now, if they knew that there was some sort of probiotic supplement or something that could relieve food allergies, if that was on the market, I mean, moms and dads would go crazy for it, because it's something that would relieve their kids from these potentially lifelong and horribly emergent situations that could happen in the future. So I think it's just a matter of kind of like introducing situations in which probiotics could be relieving from certain diseases.
Wonderful. And I was just going to say, look, I think there's always going to be that consumer who, wants to test their DNA and kind of send in stool samples to really understand their microbiome. But, it does sound a little bit nichey to some degree. I think, Steve, your earlier point on, that debate of personalized nutrition versus really let's just try to make products more nutritious, right? Obviously there's certain kind of themes that people kind of grab onto during COVID. Certainly immunity and not getting viruses is something kind of on top of mind for a lot of people, and you can tailor products as such. But in the end, I think Steve, I'd like to hear a little bit more about that debate, I guess.
Yeah, well, I think it's really interesting, and I will say that there's a lot of really good emerging technology, and a lot of folks that are presenting here. I think one of the things that we've seen, and from a Kraft Heinz perspective, is the ingredients, and Darren, you can appreciate this, right? Like, the ingredients, if it's like 2x of the cost, right, as an input, like that's a hard sell for CPGs in general. And there are companies that are using data that have been mentioned here, and there's been other companies that have been presenting today that are skewing a little bit, like 1 foot in the pharma door, right? Because they can pay a little bit more. And that's a trend that I certainly see. But I think we're all thinking about, how do we, make healthier food, personalized, focus on the gut microbiome. It's a huge market, and it's very top of mind. And what we didn't get into is the insurance companies are looking very closely at this space and outcomes. And you may see insurance companies start, paying for medically tailored foods. And there's some things that are, being floated around Congress, which are super interesting.
Yeah, you bring up a good point, right? With these startups, if, particularly around the microbiome, if they do find some functional ingredients, they try to go after obviously the prescribed medical foods market, as opposed to kind of the mass market, commercialized food and beverage market. And why? Because, well, they can charge more, right? And insurance could maybe cover some of that cost. And it is interesting, I guess, maybe in the last couple of minutes here, it's an investor panel. What startups, I guess, that are you're seeing or you're currently working with that are interesting in this kind of food as medicine, personalized nutrition, gut microbiome space? Ashlie, are you? I see you first. Yep.
Sure. Yeah, I can talk about that. So again, one that's in our portfolio, I already mentioned, was Brightseed. I think is a perfect food as medicine. One that we're looking at right now is a company that is very interesting because they are trying to use the technologies I've been talking about, AI, to determine if the microbiome of a cancer patient versus non-cancer patients are different, and then try to replace it with what they call bugs or drugs in order to help patients have a better response to chemotherapy. And I feel like that's such a perfect example of where these bridges, or where there's, the two areas are intersecting: nutrition and personalized nutrition and personalized medicine.
Michelle, seeing anything interesting out there?
I got to plug my own startups. So I think Raise Real is doing great because they're starting at the very beginning when kids are just developing their bodies and growing. And so what they're eating is literally the building blocks of their bodies. And so what better way to invest in food as medicine than to start very beginning when kids are forming themselves. Ritual is amazing because they have such a wide reach at this point, and they're really much like the millennial vitamin brand. And I can totally see them at some point And Kat and I talked about this long ago about personalizing the experience. And so whenever I feel like the technology is ready and the studies are there to back it up, for a company that has such a wide reach and such a big audience, it would be the logical next step for them. I'm also really big on cloud cities right now, and kind of decentralizing nutrition and ag. And so I'm really into like vertical farming. And there was one company I saw in the startup list here, the Vertical Oceans or something, which is doing some really cool ag stuff. But yeah, that's a really cool space as well.
Well, thanks, Michelle. You know, Steve mentioned earlier our recent investment in Remedy, which owns Nourish, which is actually somewhat competitor to Ritual, right? It's a personalized supplement, and they're using that 3D printing, which you know, has gotten a lot faster, and you know, we see potential to use this type of manufacturing to really offer personalized, you know, supplements and things to consumers. But Steve, I think we're kind of right in the deadline. Any startup you want to throw out to the audience before we end?
I'll just say really briefly, Joywell Foods, you know, making alternatives to sugar, and we're really big on companies that are really data driven in this category too. You know, companies that have a wealth of data related to the microbiome and other supplements categories is something that we're looking at. So we'll be spending more time in this world going forward for sure.
Wonderful. Thanks, Steve. And Howard, I finished right on the button here.
Yeah, well, good. Well, I wanted to throw in a question or two too. So
okay,
we'll bear with us. There's a question from the audience in the chat bar from Claude Leglise. He wanted to know whether there are specific conditions that appear to be good early targets for food as medicine, whether it's obesity, diabetes, various bowel conditions, or what. So is there some low-hanging fruit that you guys think are going to be first up?
Answer that. The low-hanging fruit, I think, is anything that's going to modulate the microbiome. Another thing is I'm interested in intestinal barrier dysfunction. This has also been linked to all chronic inflammatory diseases. And if we can find ways that help maintain the integrity of the GI tract, it prevents inflammation from getting throughout the body. So in other words, I actually am starting to believe that there might be a common ground hypothesis. I mean, maybe all these chronic inflammatory diseases are actually different manifestations of one underlying disease state. And actually targeting that disease state might have ramifications for all these different diseases.
Wow, that'd be pretty wonderful. So I'm afraid we're out of time. I had other questions myself, but I'm going to defer and thank all of you for a fantastic discussion. Thank you, Darren, for being a great moderator. Steve, Michelle, Ashlie, for your insightful comments. Really expert comments, I must say. So thank you again for all of that.